Do you know your Sepsis 6? Six steps to improve survival chances. Give oxygen, take blood cultures, give IV antibiotics, give fluids, check blood lactate, measure urine output. Do this within 1 hour. If news is greater than or equal to 5, please use the suspected sepsis screening tool. If sepsis is suspected, always give 15 litres of oxygen via a non-rebreathed mask. Then titrate the oxygen to achieve saturations of 94 to 98%. In COPD, consider saturations of 88 to 92%. Titrate the oxygen when the patient becomes more stable. Oxygen delivery is poor in sepsis and hypoxia can kill quickly. Take blood cultures before IV antibiotics, as long as taking them doesn't delay administration over 60 minutes. Take a full set of bloods, wound, urine, sputum samples for microbiology, culture and sensitivity. Do not delay treatment by waiting for sample results. And don't wait for a temperature to spike to take cultures, as not all septic patients will have a high temperature. IV antibiotics must be given as soon as possible and always within 60 minutes. Antimicrobial guidelines are on the Trust intranet or download the MicroGuide app to your smartphone. Sepsis causes leaky blood vessels, so the patient may appear hypovolemic but may also look edematous due to fluid in the tissues. Give crystalloid fluid challenges following assessment of markers of end-organ perfusion, such as renal function, and continue as long as there is a favourable response after each fluid bolus. If BP and lactate are still abnormal after 30 ml per kilo of crystalloid fluids, then the patient may have septic shock and should immediately be referred for assessment to a critical care, unless treatment limitations are in place. Take a venous or arterial blood gas to measure lactate. A lactate of greater than 2 mmol per litre is significant and 4 mmol per litre is serious. The mortality of a septic patient with a high lactate is significantly higher. This is associated with better outcomes if it falls following adequate fluid resuscitation. Urine output is a window to the circulation. The gold standard is to catheterise, measure urine output on an hourly basis and act upon urine output less than half a ml per kilo per hour immediately. Please complete fluid balance charts accurately. Please complete the suspected sepsis screening tool for all patients with the news greater than or equal to 5. Information on the sepsis patient pathway is on the reverse of the screening tool. If the news is greater than or equal to 5 and infection is suspected, look for signs of organ dysfunction as per the screening tool. Escalate to a senior doctor and complete the Sepsis 6 actions within 1 hour of sepsis diagnosis. Please remember to place a patient sticker in the red sepsis folders on each ward for audit. Think sepsis, save lives, every minute counts.